think now we'll move on to the final talk of this session here. Professor Dr. Namrata Sharma again needs no introduction, and I really thank Dr. Santosh Unawar and Dr. Namrata, who are having really busy schedules and they have to look up to her and set up the evening inaugurations, but they have spent their time because I know research is very close to their hearts, and I really thank you for being here in this session. Over to you, ma'am, for telling us how to go about a revision and rejection comments of your manuscript.
So thank you, Vaniti. I think it's a great session, and I would be, out of my own practical experience, taking you through how to go about revision and rejection comments for your manuscript. I always say, and I always believe that nothing should remain in your computer. Everything that is there should be on the internet, and that is how you will, publish. Mediocrity, it should not be done with mediocrity, but perfection is very difficult to achieve. So it's best that even if a paper comes back with rejection, you immediately address it and send it back. So I think it is important first, whenever you are trying to publish something and you are trying to do research, to know a topic in what you are going to do it. So suitability of the topic is very good. Don't do something which already is published or already been done. So you've already lost the battle even before, even before trying to fight it, because if your question or hypothesis is not correct, and if it is a me too kind of a thing trying to do something which others have already done, it will not get published. It has to be a new idea, new indication, new complication, new way of managing it, different way of doing it. Only those things, they see the light of the day much faster. Or if you're doing something which others have already done, then it has to be larger numbers, greater follow-up, larger subjects, better studies in the form of randomized controlled studies or randomized controlled trials, etc. So it is a very important before you you should have the when you begin, you should have the end in mind. You should know what you are going to achieve. So to have the end in mind is very important, that then only you can start something in a planned manner. So like I said, it is important to know what is already known, and you should know what are the gaps in knowledge and whether the anticipated time scale that you're thinking is appropriate, whether you have the support systems for this which are appropriate or not. Statistics has become an integral part of all publication, and so you should have a statistician friend who should be able to guide you. All proper protocols should be followed, including the ethics committee approval, etc. Then main concepts, measurable indicators, they are two very important things, and it is always good to review the literature first and see what is lacking in literature. It can be any kind of study, it doesn't matter. When I start to write a paper, after I have conducted a study, I would always do the results first. So that is how I do, because once you have the results, method you already know, introduction is not difficult. It is the results, because the results are going to tell you whether you need to do sub-analysis or not, whether you can analyze it differently, whether you can get out new things, because you already have data. Data is gold, and data is everything in today's world. So after you've written a good paper, and put down everything which is related to the study, inclusion, exclusion criteria, source of population, period of study, informed consent, ethics committee approval, etc. Technical information that you put down in the paper is very important. You can't say I did keratometry or I did topography using pentachem. So you have to, when you say pentachem, then you have to say which country it is, then you have to say which is the company it is making. So all those things you can look at what is already published and how you are supposed to write it down. In that way, it should be written. Now, procedures which should be identified in sufficient detail to allow others to reproduce it should be identified in such a manner and should be written. Procedures which are well established, you can only reference them. There is no need to write whole procedure about it. And once, like I said, when you're writing, say, ALTK machine, it will be Moria Surgical, Antony, France. So everything has to be mentioned as per how it is mentioned in a publication. Now, statistical, You have to provide data relevant to the research, and the data presentation should be clear and simple. Always put absolute numbers and put percentages and also the p-value, and findings should be in the logical sequence. Do not repeat the data which is already there in the text. Whatever the journal guidelines are for figure, tables, illustrations, etc. should be followed. And like I said, whatever is available in figures and tables, don't put it in the text again. There is no point. So every journal has a different way of putting tables and figures, and that should be followed. And in discussion, you don't have to put everything, you don't have to put the entire review of literature, but only what is novel, what is important, and what is your major finding in the research project. You start from there. And do not overinterpret the data. Whenever you write discussion, compare and contrast with other results, explain conflicts if any, list the limitations of the study, the clinical implications of the work, and also describe future problems for the peers, and also list the unanswered questions and the possible research avenues that might resolve these issues. Once you write all this down, the reviewer has a fair understanding that he knows that you know what you are doing. Of course, acknowledgement references in the style which the journal wants should be written. So there are two ways of doing it, and whatever the journal says, that should be done. This I just put down what is my order of writing. So I put down the tables first, results, then the discussion. Introduction you can do any time, and material and methods is already there because you've written the protocol. So recheck the references again the day you are submitting, because some reference would have come one day before or in the morning and you've submitted, not listed that, they'll say it is not cited. So always do that. Now rejection, if you receive a rejection letter, you should never give up. Rejection just means you should think in your mind, rejection means it is not their priority. And if you want to make yourself happy, you think rejection means it's their loss, not your loss. So because you know that once you've written a paper, it is going to see the light of the day. Be it any number of times, it does not matter. When you get the comments from the referees, read carefully, because this is an opportunity to improve your manuscript. It is not rejection. It is another opportunity. He's adding to what you already know. Address both positive and negative comments. First thing is just copy paste all the comments, put it down in a paper, and then see how you are going to answer those comments. Directly address response under each comment and thank referees for positive comments. Don't confront. You want referees to accept your papers. You don't want them to reject your papers. Sometimes you might think this is wrong, the referee is wrong. No point in telling him that he is wrong. He is only going to review the papers. So you are at the receiving end. So don't confront. If there are any errors, etc., say we apologize for this error. If he is given good suggestions, say thank you for your wonderful suggestions. So those kind of acknowledgements and diplomatic language is required. Make changes within a week, 7 days. Beyond 7 days, it should not remain in your computer. Delayed reply means delay in publication. Delay in publication means somebody else will do it, and then you are going to sit and cry about it that you had already written and you didn't send it in time. Changes, additions, or corrections should be very clearly identified like this. So when you put down something, title page, page 1, line 1 and 2, page 1, line 1 and 4. So for everything, it should be very clearly highlighted where the change is. And whatever the change is there, that also should be highlighted in the copy where the changes have been made. So this is just about diplomacy as to what I was talking about. Be polite, and whatever is not there, you can very easily say that this data is not there with me, and we can plan a next study with this. The reviewer is not going to reject it because of that. He's going to, he's in fact going to, he or she is going to appreciate your, having said that this is not possible in this particular study. Now the reasons for manuscript rejection is when the material is not relevant to journal's readership. So if you are sending something, say, something, for instance, JAMA Ophthalmology likes to take glaucoma and retina articles more. So if you try to send something like cataract, a new technique, difficult to publish there. If cataract, new technique, send it to JCRS, which is probably easier to do. Then inaccuracy of the data, inappropriate instrumentation, inaccurate or inconsistent data, small sample size, defective tables and figures, inappropriate statistics, overinterpretation of results, incomplete, inaccurate or outdated review of literature. All these are the causes of rejection. And you would not make these mistakes if you follow what I had told you in the previous slides. So to avoid this, you should, plan it well. Like I said, keep the end in mind. Keep your whole concept in mind that I have to publish this study in this journal. If it doesn't go through, then this. Step down your journals. Ophthalmology, if it is not good, I'll send it to cornea. If it is not good, I'll send it to eye contact lens or whatever. So just put it in your mind like that. So this is just to show that you can do it. Initially, you may publish in journals which are not that good, like we did it when we started our career, but you also become experienced with time and you know how to publish it. Now, there are certain things which, for instance, power of a case report. I've put down this because for years together, one cornea we've been using in multiple patients. It was in 2011, we realized this is not published, that component surgery of cornea, one donor cornea for 3 recipients. So there are sometimes very simple things which are not published in literature. So you have to be vigilant about it, what is published and what is not published. Then you have to define your areas of publication. I say that because if you do your publication in one particular field, the chances of acceptance are more because your credibility is already established there. So if you are into cornea or cataract or refractive, try and continue that in that particular field only. Sometimes reviewers are very helpful. So when we send this Pseudomonas keratitis after collagen cross-linking for keratoconus case report, he rejected it. And then second letter followed and said that if you add review of literature, I can put it in your, I can take it as a review. So we put it as case report and review of literature. So he actually helped you because you were submitting a case report and he made a review out of it with your case report. So they're not always bad. The reviewers sometimes, really help you also. And you have to be vigilant in the sense that whatever you present in the conferences, don't go and sit on it. Because if you sit on it, so many people are, watching it, and so many people are imbibing. Everybody is very intelligent. If they have done something, they'll publish it, faster than you or before you. Then there may be certain genuine concerns, like, for instance, just one example, orokeratoprosthesis came. So we immediately did, some cases and published because we knew that orokeratoprosthesis, nobody in UK or USA will do because it is an India-centric product. But however, this got published in British Journal of Ophthalmology. So what I'm saying is that whatever is novel, whatever is different, whatever is new, you should concentrate on that. Then whenever you are doing studies, you have to be very vigilant on the website also. So for instance, we were doing this study on fungal keratitis, and our study design was similar to the study designed by Arvind. But when we were planning the study, we realized that we would be duplicating the study. And this is there, when you register your trial, it is there on the website. So once you realize you're duplicating your study, change the design of your protocol so that you get something else out of it. And again, do not duplicate and then compete, with somebody else after having done a similar study. So always publish after you present. This I have already told you. Whenever you present in American Academy, you publish in ophthalmology. You present in AIOS, you publish in Indian Journal of Ophthalmology. You present in ASCRS, or in ISCRS, you present in JCRS. So this is very important. Likewise for movies, you can win. This is one example where we won awards for movies in the same year for the same film 3 or 4 times. But when we went to publish, we could not publish because we were late in sending our material for publication. Somebody else had already published before us. So that's why I'm saying you have to be really vigilant and you have to be fast. And like I said earlier, do not give up. Rejection means it's not their priority. And sometimes you have to change categories. So if I have this intrastromal fluid drainage with air tamponade rejected from cornea, so I will change the category. I know BGO requires category of technique. So I'll go and put it in the technique category, not in the original paper category. Because in the technique category, there would be fewer articles which are going to be accepted. So that's what I'm saying, that you have to be vigilant to know which categories you have to choose and how you have to change the categories if any of your paper is rejected. Change continents. This I have always told everyone, that if something rejected from AIOC, Archives, Cornea, you are targeting US. You are targeting US reviewers. So you change your continent, you publish, you send it then to I and British Journal of Ophthalmology because the reviewers would change. It's UK. Or Clinical and Experimental Ophthalmology because that's Australia. So the reviewers will change. So to conclude, I would just like to say that no amount of clever writing can cover up for a poorly designed study. So writing is important, but a good study is also very important. And scientific writing is a skill which comes with practice. There was a publication which got rejected 17 times, but still saw the light of the day. 17 times, not 70 times. But the point is, never keep it in your laptop. Always, it should be on the internet and it should be there on the cloud. So to conclude, all ophthalmologists world over are intelligent, all of us are, all are thinking alike, all are doing similar things, so you don't have to be smarter than them, but you have to be faster than them in conception of an idea, execution of an idea, publishing the idea, and also addressing the reviewer's comments when your paper gets rejected. Don't keep it for more than 7 days in your computer. Thank you very much for your attention.
Thank you very much, Dr. Namrata. I think that was a comprehensive coverage of how one needs to deal with your manuscript, right from how you perceive your study and how you take it through your research writing, and how you need to put it or present it to the editors or when you submit to a journal, and how you also need to address the rejection comments. There are times when you can also refute the rejection comments. Yeah. Okay, I think I thank you all for this packed hall, and here I have Sudipto asking one more question. Yes.
Yeah, this. I was just asking if how many minimum reviews should we have, ma'am, so that the paper gets accepted, and how important it is that from the, I mean, not the reviews, references, minimum should we have, and how important it is that we should minimum references for paper to be accepted, and quoting of anything from, if reference is given, then how important it is that it should have a quoting of the maybe a line or a picture from it. How important is that?
You should not quote verbatim from any, it has to be written in your own words, that's one. Then number two is that the number of references for every type or category of the manuscript is already defined by the author guidelines or the submission guidelines to the authors by every journal. So one has to look at it. It would vary if it's an original article, it would vary if it's a review. So those have to be addressed according to the journal's guidelines. Yeah. The references always has to be cited in your manuscript. It has to be cited in your manuscript. You cannot give a reference without a citation in your text. Yes. Thank you all, and thank you for this packed hall for an IJO session. Thank you very much. Looking forward to more quality, high impact submissions from all of you.